Thank you all, and thank you for patiently waiting. And welcome to all of you to the inaugural session of Simplify MVT Academy, the leading online training platform for medical tourism stakeholders. This is something unique that we are doing here, and we are very excited that you all have joined us in this informative session on CyberKnife with the esteemed speaker, Professor Dr. Shyam Shrivastava. You all must be wondering, what is the Simplify MVT? Or probably, since you're all our partners already, many of you must be using it already or must have heard about it, or at least. At Simplify MVT, what we do is we understand the complexities involved in the medical tourism industry. So that is the reason we have developed a comprehensive B2B SaaS platform that streamlines and expedites the processes for the hospitals on one side and the other stakeholders involved in the entire process. So from getting the opinion request to the visa invitation letters and the patient confirmation, Simplify MVT makes it extremely simple, as it says in the name itself, providing back and forth procedures that is involved, which all my colleagues here who have joined us are very familiar with. So this saves your valuable time and also the resources. And what we did going further, one step further, is in addition to this platform, which is simplifying your work, we are proud to introduce Simplify MVT Academy. Our academy is actually dedicated to empower medical tourism stakeholders through a series of online knowledge sessions and courses. We aim to provide you with industry-leading expertise and provide you insights for your practices and to have a better service for your patients. So with this process, we want to empower you. So in this session, we have with us Professor Dr. Shyam Shrivastava. He's a renowned expert in the field. He will be sharing with us invaluable insights on CyberKnife, specifically in relation to medical tourism. CyberKnife is a cutting-edge technology that has revolutionized cancer treatment, offering precise and non-invasive procedure. Professor Shrivastava will delve into the significance of CyberKnife and its role in advancing medical tourism. So, from the entire team of Simplify MVT, I would like to extend a warm welcome to Professor Shrivastava, who will give us this knowledge today. Let me give you a small insight, a brief about an introduction about Professor Shyam Shrivastava before we start. Dr. Shyam Shrivastava, who is also a professor, is a director of radiation oncology at HCG. He has an extensive experience of over 40 years, and he has handled more than 10,000 cases. So imagine the wealth of experience that he has gained. He has expertise in all types of cancers, especially in gynecological, head and neck, and CNS. He is recognized as an expert in the modern therapy with the range of services that's available end to end. He's gained wealth of experience hailing from the most renowned Tata Memorial Hospital, and he's published over 250 research documents in both national and international journals. He's an amazing teacher, and he holds several leadership positions in many oncology associations. So it's a great privilege today that he is with us for the first inaugural session of Simplify Academy's online session. So dear friends, all of you have joined on this webinar today. I request you to provide your generous reactions through the reaction button, and please welcome Dr. Shyam Shrivastava. Through this academy, as we welcome you to this first inaugural session, we look forward for this fruitful and enlightening session. Professor Dr. Shyam Shrivastava, the screen is all yours. and Mihir is going to assist you with the presentation. Over to you, Professor.
Wait, sir, wait. You are mute. Wait, sir, sorry. I don't know why. Did you click on the mute?
Mute. Can you hear me now?
Yes, we can hear you now, sir.
Yeah, I think if you can do the full screen, that will be great.
I'll do that.
Maybe somehow by mistake I was
Yes.
mute. So am I audible here?
Yes, sir.
Yeah. Thank you, Vidyarani, and thanks Mihir. And I'd like to thank the Simplify MVT Academy for really this wonderful session. As I understand, I've been told that mostly you all are involved in the medical tourism. And you know that medical tourism is really a very wide subject, and it involves a lot of things. So not only the cancer treatment, but also the various things. So what we thought, or rather in that case, that because we should give you something which is a very, very unique, especially in the treatment of radiation, the kind of treatment with state-of-art treatment with the radiation therapy is given nowadays for most of the cancer patients. And I will really focus something on the CyberKnife, as Ms. Vidyarani was mentioning about that. The initial part of my presentation, very quickly, I thought maybe around 10 to 12 minutes before you can ask the questions. We'll give you some the basic idea that what is the radiation, what is the treatment, and how it is done, and what is this equipment, so that it will generate the question, which is the doubts and other things in your mind. So you can really very well mention about those. So can I have the next slide?
Yes, sir.
So you know the cancer is not something new, and why I put this slide is basically there are two things which I was talking about. The more than 70 million years back, where the dinosaurs were there. No, not just continue with this. I'll just keep on saying next slide so that it will be here. So you know the cancer can still be there in those fossils which we find from the dinosaurs, and we found certain benign tumors, and possibly some of the dinosaurs could have been dead because of those tumors. So basically, when we are talking of the cancer or the tumor, there are two basic things. One is we call it as a benign tumors, and another is a malignant tumors. Now, benign tumors we all see from the various population that you will see there is a lump in the body, which is in the hand or at the head, and they do not go from one place to another place. They remain in one place only. And there is a problem that if they grow in size, it can cause a problem. And why I'm mentioning about this, because there are a lot of benign tumors that may be within the skull or in the brain. They are not harmful as such, but if they grow in size, they can compress or they can press over the normal tissues and normal brain, and which give rise to the problem. So I'll very briefly focus on that. Another thing which we have seen in Egyptian mummies, so that is also something like 1,500 years before the Christ. So almost you can say is 3,000 years back. Some of these patients, or rather some of these mummies, we have found some bone tumor. So the cancer or the tumor is not new. It is from the very beginning when the mankind has come on this earth, or the life has come on the earth. It is basically there is some kind of change in the tissues or cell. It is something like when you are doing you are manufacturing something, there may be some defect in some of the area. This is what is there, which is cancer. So yeah, carry on. Next slide, please.
Sorry, sorry. Yeah.
So when you have these cells, normally cells, they grow from 1 to 2 and 2 to 4, and like this, they keep on growing in our body. If one of the cell had got some kind of defect, that can convert into the cancerous cells. This is what happens in these cases where the cell have got something defect in their maturation or in their growth. That is what is we call it as a cancer. So here in this picture, you are seeing the green color or blue color, what you are seeing, these are the normal cells, but there may be a one cell which you see at the bottom, which has converted into, which is not really growing properly, and that can give rise to a kind of what we call it a cancer, or they grow. So when they grow, there is some problem in these, because these cells do not have a good control in their growth. In our normal cells, when we find there's always a controlled growth. Something will grow to a certain extent and then it will stop it. While in these cases, this growth stoppage has stopped. So they cannot really grow to that extent. They cannot really stop their growth and they continue. Now, as I mentioned about the benign tumors, they still remain within, but for the malignant tumor, they keep on growing. And then some of the cells may be loose. They can leave from one place and they can go to other. We call it as a metastasis. This is what is cancer. And since these are the abnormal growth or the abnormal cells, they can have a deleterious effect on our body. And therefore, we have to control it in some way. So next slide, please. Mayor can go to next.
Just a second, sir.
Yeah, right. So basically there are three types of treatment for any cancer, you can say. One is a surgery. I'm not focusing on that because then I will take much more time, where you remove the tumor or the growth. Second is radiation therapy. And third is the chemotherapy where it can be given. No, back, please. So for the radiation therapy, we always know, I'm sure some of your members maybe read about some science or maybe the biology or the physics in the beginning. These four people we owe to the entire radiation therapy. Wilhelm Conrad Röntgen, who discovered X-ray. Becquerel has shown us the radioactivity, and Pierre Curie and Marie Curie gave us the radium. So these are the people, and fortunately all of them have received the Nobel Prize. I always show this slide because our existence is because of them. Next slide. Now, when we are talking about the cell, the damage which the radiation can cause, it is mainly because of two reasons. One, we have got a DNA which the cells grow. It can be a direct effect where the chromosomes can be broken. And second is the indirect effect. What happens then? It does the ionization. So our cells do have a lot of water, which breaks into the HO or H or HO into H2O2, and hydrogen peroxide, we know H2O2 is a toxic substance. So the radiation can work directly by damaging the chromosome, so the cell will not grow. And secondly, by creating the toxic substance like a hydrogen peroxide or HO group, so that cells will die because then they cannot live. So this is the basic principle. So everybody should know about this, how the radiation works. Now, next slide, please. So now when you are thinking of the giving radiation to the patient, there are various machines have come. And I'll come to the focus as Ms. Vidya Rani was mentioning about that, how the radiation is given. These are the different kind of radiation equipment, and where either with a cobalt machine or with the linear accelerator, where the radiation can be delivered. Now, when you are looking at the bottom diagram, where you can see inside of the linear accelerator, where the radiation accelerator, basically the electrons are accelerated and they are allowed to hit outside. So when you are looking on your right side, the cartoon, where you can see that the radiation is coming out from what we call as the collimator, and at the bottom you see one pink form where the patient is lying down there, where the radiation is directed. So what is happening basically, that radiation is produced in the machine, and these are high energy X-ray or high energy radiation. We call them as photons, and they are emitted on a body of a patient. The entire thing which I am going to really focus now, how we are going to direct these X-rays or the photons is the matter which we have really developed over the period of time. So these are we call it as a linear accelerator. Now you can see it at the bottom that the radiation is coming up and putting on the patient so that it hits the tumor, it damages the tumor. That's the whole concept in that. So these are different kind of machines. In the next slide, you will see that the machines are developed to give a very high focus and pinpoint radiation therapy. On the left-hand side, on the top, you will see this machine, we call it the gamma knife. Now you can see the gamma knife is there. And at the top, you will find on this machine area, the gamma knife has got the cobalt sources, which is generally 201 cobalt sources, which are directed on the tumor. And it was initially developed by a neurosurgeon, which called Lars Lexell. So this is the one, which is the machine. Now, this was basically developed by the neurosurgeon. So therefore, it was mainly focused on the brain tumors only. So whether the brain tumor is a benign tumor, which is a non-malignant tumor, or maybe a malignant tumor, anything can be treated with the gamma knife machine. On the left-hand side in the bottom, you will find there is a fixed frame where the patient, you can see it here. So the gamma knife machine requires a frame so that patient do not move during the treatment. Now, this whole procedure is quite lengthy. It takes almost whole day, putting the frame, which is an invasive procedure. You have to have anesthesia, then put a frame. Then you took an MRI or the CT scan, and then finally plan it, and then give a radiation therapy. Then another neurosurgeon, which is called John Adler, which you can see on the second gentleman, which you are seeing on your picture. He was also working with Lars Lexell, and he was thinking, why only to focus it only the brain tumors? We can do it somewhere else also. So what he did that he put the linear accelerator on a robo, because by the time he came, the robo technique were developed quite a lot. The computers were very robust and strong enough so that you can see it on a picture. On the top, you can see on the right-hand side, there's a couch when the patient will be lying, and the linear accelerator, which is like a small nozzle-like thing, like a bottle, which is a linear accelerator. And the right-hand side, lower bottom, the room, patient is lying there, linear accelerator focus. So this can be not only for the brain tumors, it can go for any part of the body. And a lot of studies have been done on the prostate cancer and the liver cancer and so many. So I will show you at the end that a lot of indications have really developed for you, especially to know. Next slide, please. Now I'm showing you the difference between the next slide, please. I'm showing you the difference between these two machines, what happens. Now, the linear accelerator, which is the common one, which you can see it on the left-hand side on the top, this machine can rotate in one direction, in one axis. So that patient is lying like a circle, it will move. And can you move can you click it? Yeah, just, no, other side, on the linear accelerator, you put it. Put it on the left-hand side on the top, yeah. Now you can see this machine is moving in this direction. It will move to 360 degree. And it can rotate and it can give radiation in one angle, right? But what John Adler did was quite different. Now, just move this second machine, which is on the left side bottom. Now you see the difference between these two machines. Now this machine, which is called a stereotactic machine, we call it as a CyberKnife. This can rotate and move in any direction you can see. So not only to the brain from one circle, it can really radiate from various. And the cartoon on the top of these machine, you can see how the radiation is going in a different direction. So what happens? More number of beams, lesser the dose to the normal tissue, much more focused dose to the, no, it's okay, fine. Much more dose to the tumor. Next slide, please. Next. So what happens that initially we were thinking with a gamma knife only to the brain tumors, as you can see it on intracranial. Now with the CyberKnife, you can treat even the spine, to the lung, to the other tissues in the abdomen, to the prostate and anywhere else. So this is a great advantage which has come with the CyberKnife, where the same kind of radiation can be given from a various different angles. Next slide. Now I'll go a little very quickly on this. This is the process how the radiation happens. Now, why I'm showing this slide is basically that you will know that when the patient comes, and patient generally expect that the moment they come to hospital, within a day or two, they should be treated and they should go back. But that doesn't happen so quickly. Next slide. This slide, you can take it. And so what happens then when you look at in the very beginning, we examine the patient, we start putting something like immobilization devices that during radiation, patient will not move. You can see it that the patient has got immobilization devices, they cannot move it in. Next slide, you can see in the bottom, in the top of, in the middle of the top row is a simulation. We take it CT scan or MRI. Then the all contouring is done. We find out where the tumor is there, where the normal structure is there. Then go to the bottom on the right-hand side at the first slide, where do the treatment planning, where the medical physicists and the technology and the doctors will sit together, radiation oncology. Then patient goes for the machine treatment, as we have shown you with the CyberKnife. And after the entire treatment is over, we call the patient for follow-up. So from immobilization, it may take around 2-3 days. Simulation will take 1 day. The contouring may take another 2-3 days. Then treatment planning will take another 1 or 2 days. Then treatment starts, which may be 1 fraction or 5 fraction or 7 fractions, 7 times. So when you are explaining to the patient or maybe some doctors who were there, that it is not that patient comes from, just for example, patient comes from Bangladesh and then they are treated in 2-3 days and goes back. It may take around a week or 10 days for treatment. And so that is one. And secondly, when the patient has been treated, they should come for follow-up because we want to know that how best it has been treated. If there are something, some complications, something, we can treat them. It should not happen that patient is lost after the treatment. They should be continuously under the surveillance of doctor so that the best kind of treatment can be given. Can we have the next slide, please? Now, I'll give certain examples where it is very important that how the CyberKnife is much more helpful than the other kind of equipments of radiation. One is like, these are the benign tumors, like we call it acoustic schwannoma. These are the tumor which you can see, which is yellow in color here in the picture. And you can see a normal structure beyond the pink color or the magenta color and the blue color, where there is a normal brain stem, we call it as. So the midbrain brain stem is there, which is very sensitive. If we would have given radiation with some other machine, it would have really given much more dose to the surrounding structure of brain stem. So then it causes more problem. With the CyberKnife, as you can see it here on the top, there is steep dose fall so that the surrounding structure gets a minimum dose. Next slide. Now I will go with very few examples. This is the pituitary adeno, which is also very common. Here again, you can see the brain stem can be saved completely, you can say, so that there will not be much more reaction in this. So it is very sharp. Next slide. This is very common benign condition called it arteriovenous malformation, where again it happens that the patient will have a problem. Sometimes they bleed and the patient become unconscious. Here again, this is a really wonder treatment can happen. There are various other surgical techniques are also in this, but this is a single fraction of radiation in one time. You give radiation and patient feels much better. Next slide. Now, as I mentioned about the CyberKnife, this is not only for the brain, but also from the various part like a lung. If there is a small lung tumor, and you can see it here, that the lung is a moving tumor. So it is very difficult by radiation just to point the radiation to the tumor area and not radiate the lung. While in case of this CyberKnife, because it tracks the tumor, you can have a very little lung radiation, but you can very sharply give radiation to the tumor area. Next slide. And also like a spinal metastasis, where the spinal cord is very close, if we give radiation, there may be a damage, patient may become paralyzed. So that this CyberKnife giving a very focused radiation to the anywhere in the spinal cord, spine, to the bony area or very close to the spine, that is very rewarding. Next slide. I just wanted to give few examples so that you are, but the prostate cancer is something which is very, very important in this. In the earlier period of time, by giving radiation by the linear accelerator, it used to take 6 or 7 weeks. Now we have started understanding what is the prostate cancer and what is the biology of prostate cancer. We can radiate these cancers maybe in 5 times and good enough. Just for 5 days it can be given. Or maybe say around 3 weeks treatment, depending on what kind of prostate cancer is coming, how a small tumor is there. So that it is again, rather than having 7 weeks of treatment, 7 weeks of staying in a city, you can have it for 1 week or 10 days time and you can go back with the prostate cancer. And the control rate is almost same as that of surgery or maybe the 7 weeks of treatment. Next slide. These are something very, very rewarding. The functional disorders like a trigeminal neuralgia or something, where patient generally gets a severe pain in one side where patient will not be able to eat and something. And by giving a very high dose of radiation, here you can see I have written 85 gray, very small area of the trigeminal nerve. And immediately after the radiation, patient feels that they can swallow, they can eat, and the pain has gone. That kind of rewarding is there. And around 70–80% of patients, this can be really wonderful. Next slide. So there are a lot of advantages with the CyberKnife because of the accuracy and no hospital stay is required. They can go, they can stay in their home. And generally the treatment is around, say around 35 to 40 minutes. In a hospital, they have to stay for 1 hour or 1.5 hours. There's no anesthesia. It is non-invasive, as Vidyarani was also mentioning about that. There's nothing that you have to give anesthesia. And it can be offered to any part of the body. So these are the basic things which I just wanted to highlight so that some of your queries will also be clear and you will be able to see it that how it is given. Thank you very much for all of you listening. And this is something, maybe the next slide is just a concluding slide, the last slide. Yeah, so the indications are increasing. As I mentioned, very few here. I mean, this slide, you can keep it with you so that how many tumors really can be treated with the CyberKnife. The only thing is that a tumor has to be relatively small. Generally, less than 4 centimeters is an ideal tumor to be treated. Next slide, the last one. So we are really excited with this. And basically, the entire thing which I showed you is basically precision and radiation therapy. Thank you very much for listening. And I'm happy to question if you have some question, we'll be able to.
Thank you, Professor Dr. Shrivastava. This was detailed and informative. I'm sure all the attendees here today would benefit from it. And we would definitely like to take questions further, because most of the members that are here today, except I think 1 or 2 are doctors, but rest are all non-clinical staff members who actually deal with patients on a regular basis. We make the bridge between a patient and the doctor. And patient spends a lot of time with us in terms of counseling, making a decision, because that's a critical time that they spend time with us from the time they've been diagnosed locally in their home country until the time they make a decision to travel to India for treatment. That is a period of very critical time that we spend time with them. And they're apprehensive. A lot of them are scared. They have a lot of questions. And I think that's the reason we chose to arrange this academy in terms of providing this knowledge to the people who are on the ground so that they get empowered. So I would like to ask a few questions which are completely probably non-clinical, which will actually help the patient, if you don't mind to help us with these, to take it forward, doctor. I really liked, yeah, I think the last slide summarized, it said finesse and precision. I think this is very, very critical in terms of understanding, because that's how it differentiates in terms of CyberKnife to other procedures. For us to understand, when a patient asks me, they come to me, why should I go to CyberKnife? How is it different from other traditional cancer treatments? can you help us to understand from a layman's perspective, if somebody tells me, why should I choose CyberKnife? How is it different from other traditional treatments? If you can share with us.
Yeah, I think Vidyanani, you just said very nicely. I mean, the last slide when I was shooting, it is the precision. If I give an example, in earlier period of time when there is a fight between two countries or something, we used to have a cannon. So you fire whatever you call it from the cannon, and it will be very large and it is going to destroy a larger area. But today is the era not of cannons, but of the missiles. And these are guided missiles. So today, if you want to really focus on one particular room in one building, you can guide a missile and you can do it so that you are not destructing anything else, but you are just damaging the area. So this is what is there in today's concept. The bigger machines which were there earlier, or even the larger linear accelerator, can really definitely do the damage, but the surrounding area will also be damaged. If I want to really hit one room only out of this building, or one tumor out of the normal structure which are surrounding, I can focus it much better with the CyberKnife, and it is highly focused. And I showed you that it can fire from any angle rather than the linear accelerators, which have they rotate only in one axis, right? So that's the difference between these two, that when we are radiating, we are not radiating only in one direction, but we are radiating from multiple directions, and we can really focus much sharper beam to the tumor. And it is much more important in a smaller tumor. When the tumor is very small, we don't want to radiate the normal structure. The patient should go back to the normal life, ideally.
Correct. Yeah, that was a beautiful example. So that very clearly we can tell the patient that they don't get harmed into other cells. So very tiniest tumor can be targeted and they can be treated. I think this was a beautiful example to relate to us. Thank you for that, Professor. And I think some of the members have difficulty to hear. Can you all indicate to us if you're able to hear us? If there is any technical problem, sound problem, just show us a thumbs up to show that if you're able to hear us. If there is any issues, I can see a lot of thumbs up coming through that people are able to hear. So if you have a challenge in your own system, probably switch off and on, or re-log in back again so that you will not miss out on any of the information that we are sharing today. Moving forward with our next question, I had a question about different types of cancers that can be treated, but I think the last but one slide gave us a comprehensive list of types of cancers that can be treated. So we will share that information with our partners so that we don't have to repeat that right now. But the next question that I want to ask is, you mentioned that the length of stay that our international patient, when they travel, they need to really keep in mind that 7 to 10 days would be the treatment time that they will have to consider while they travel. But before they travel, is there any specific list? I know it will be customized for each case or depending on each specialty where the tumor is in the particular body, it would be depending on that. But are there any specific mandatory tests that they need to produce in terms of, before we send out the reports to you, if I have a patient with me, do I need to check that 1, 2, 3, 4, these are the list of tests, whether the patient is already done or not, so that I can save their time, save your time, and go to the next step. So can you guide us, what are the prerequisite investigations that is required before we approach to you with the patient?
There are 2-3 things which generally we need it. One is the confirmation of the disease. So some physician or the surgeon has already seen the patient earlier and they have diagnosed, maybe for benign tumor, it may not be the biopsy possible, but maybe for malignant tumor, means the cancerous tumors or cancerous cells. If the biopsy there, that gives us a chance that we can directly go just by reviewing the slides if required. That is one thing. So that we know there is a disease for which we are really targeting. So that is one thing. Now, many times I'm just elaborating each one of them, so it may take few seconds or minutes for that. Now, in case something has been diagnosed with a biopsy in some country, many times we'd like to confirm if it is not correlate with the symptoms or to the disease. So if the patient comes with the biopsy slide or the paraffin block with them, then if it is required to review the slides, we can give it to our pathologist to confirm, or sometimes we have seen that sometimes there is a variation. So treatment can also vary. That is the reason that we wanted to have this slide. So that is a histopathology slide, or the block, you can call it as number one. Secondly, is there the patient has got some other diseases, like if the patient has got a severe diabetes or cardiac condition, somebody has got a stent or something, if that information is there, we know what we need to do for this patient, how carefully we have to do another investigation. So that is second thing. Third thing is that invariably for the brain tumors or maybe the prostate cancer, something, patient do have their own MRI or the CT scan earlier. So that will be very good. And if they can come with their CD or the DVD along with that, then possibly we may not have to repeat them. Sometimes happen the quality is good, it has been done very well. Why unnecessary to repeat and then really spend money or the time in both of them? So that can also be very good. If they have got a scans with them, they can bring it in that. Secondly, thirdly or fourthly, whichever you call it at, the patient comes, if we know beforehand what are the investigation has been done, what has been diagnosed, what has been treated earlier also, that will also help us, so that if we get beforehand, we can really ask, get these investigation done. Simply why I'm saying that whenever the patient comes, we need to do the MRI or the CT scan for the planning purpose. In that case, we use the contrast. So if the patient has got a good blood report with their creatinine level, or that will also help us, that we may not have to repeat it. So my contention is saying if they already been diagnosed, then we will try not to repeat many investigations, because that will again take 1 or 2 or 3 days for
and
so
cost saving as well for the patient.
Absolutely. So
time and cost both will be saved.
Both will be saved in that.
Yeah. Absolutely. Absolutely. Yeah. Thank you, Doctor. I think that was very informative for all of our partners, because this is something that we could help, as a facilitator in terms of coordinating with the patient. And whenever there is, patient who needs to make a decision to go for any high-end kind of treatment, one of the questions that most of them would have is, are there any potential side effects, or what are the risks that would be involved? Because any kind of treatment, probably we cannot deny if there is any associated potential risks or side effects. So with CyberKnife, are there any risks involved, or what would you think would be any side effects that they can be protected with?
No, actually what happens that ideally when we are talking of the side effects, it all depends what area we are treating. I'm just giving an example that I showed you one slide for trigeminal neuralgia, right? So we find out where the nerve is there, trigeminal nerve in the brain, and we focus it and give radiation exactly in that area, right? Now, what happens, there will be a smaller amount of radiation in some nearby area and also in the nerve. So when the patient has got a pain, there are possibility for a short period of time, they may be having a numbness in the face. There may be a little bit hearing problem for some period of time. So those things can happen in these patients. And depending on the side, we always explain to the patient what are possibility in a short period of time, within a month or two, or what are possibility on long term. What are the side effects which can resolve by themselves within 6 months or 1 year time or 2 months time, or what will take years together to resolve, and something what is unrepairable. So suppose I'm just giving an example, some tumor is very close to the optic nerve and patient has got a very partial vision or no vision. When we radiate, there are possibilities from one eye, patient may become blind. So that we always explain. Patient being radiated with a prostate cancer, rectum is very close, patient has got a lot of problems, some earlier infection. there are chances they may have a bleeding while passing motion or bleeding while passing urine. For some period of time, this can happen. So depending on what site we are treating, there are possibilities, but we always explain that this can happen in 10% of patient or 50% of patient or 2% of patient. Depending on those areas, we will always explain that what happens. So there's nothing like a very fixed template where these things, side effects will happen. But by treating it can happen. And it does not happen that every patient will have these side effects.
Yeah.
Some patient will have, some patient will not have. I mean, we have seen that 2 patients have been treated at the same time. One patient had little complication, another was just walking and happily around, moving around. So this can happen, but we will mention about that once we get some information. Also,
so during consultation, they will be in detail evaluation about the risks as well, isn't it?
Absolutely, absolutely. And one more thing I would like to mention when you ask me about what investigation, we may look at the scans like MRI or CT scan or patient's information, but always the final decision of the treatment is taken when we examine the patient, because one patient may be very strong enough to take treatment and tolerate without much problem. Another patient may not be able to tolerate. So looking at the patient general condition and how much they can tolerate, sometimes the treatment can also change. It has happened once or twice that patient has sent all the reports and we said, yes, CyberKnife can be done. But when the patient came, we repeated the scan and we found out the tumor is much larger. So CyberKnife is not really very helpful. We can give something else. We can offer something else. This can also happen in a smaller percentage of the patient.
Right, right. So during the evaluation process, during consultation, very clearly, this was one of the questions that I was going to come to, but who would be the actual candidate who are eligible for CyberKnife? I think you answered that in this particular segment, so that you will clearly evaluate and tell them whether they're really a candidate or not.
Absolutely, absolutely.
Yeah, perfect. I think that's excellent. As a medical tourism facilitators, we always take pride in giving the patient a 360-degree care. That means we make sure that the before and after care is taken care for the patient. So we spoke about the pre-investigations that's required so that we give them enough information and support them so that both cost and time is saved. But after, okay, they come to you, they have the CyberKnife treatment, they know the pros and cons, they made a decision, and by God's grace, everything goes well. But when they go back home to their home country, what are the post-treatment care and instructions and the recommendations that needs to be followed? It could be again unique for each case, but there could be a broader recommendations for CyberKnife in particular that you would like to provide as recommendation that we can train the patient or counsel the patient, and also on a regular basis ensure that they are following the protocol so that the optimum results are maintained.
So basically, when you are looking, these are the post-treatment surveillance or post-treatment care to the patients. One thing generally after CyberKnife, there are hardly any complication. We don't see much complication in the patients once they go back home. We invariably prescribe them some kind of medication, some kind of the treatment which need to be given for around 2 to 3 weeks, which we give it during our discharge summary, that treatment to be taken. We explain the patient. I think one thing is also very important, that the one physician or the surgeon who is basically maybe oncologist or something close to the treating oncology patients, cancer patients, if we have an address of that person, we can give letter what needs to be done for this. So what we have done, we invariably give quite detail that these kind of radiation which I have done it, and some care has to be taken for this patient we prescribe. And so that what happens, the physician or the local physician or the surgeon who is taking care of patients their own country, it becomes much more easier. They can communicate to us either through you or asking this, my patient has got a little bleeding for last 2 days, what should I do? We can prescribe, we can tell them this is going to happen for 1 or 2 weeks and then it will be all right. So it becomes little easier that a referring physician, if you know the name, we can also write to them and can also communicate to them, because that is one.
Perfect. Yeah.
Second thing is that if the patient want to contact directly, by all means, we are happy to really tell whatever is required. That can be done maybe through you. So
Sure.
that is perfectly fine in that.
Yeah, I think ongoing communication, as you rightly said, doctor, would be very critical. So we will ensure that that ongoing communication is there between the patient as well as the referred local oncologist, so that the best aftercare is taken care for the patient. That we will ensure that. I would like to go to one last question from my side, and then I open the floor for the audience to ask questions. Audience have several questions to ask. What could be the success rate in terms of CyberKnife? And do you have any interesting specific case study in terms of an international patient who came to you and had a really brilliant success in terms of any particular interesting case that you would like to share with us?
I think when we are quite choosy, unfortunately, I think if you say, we don't really treat anybody when there is a doubt that it may not help. We will try to do something else rather than CyberKnife, because two things are there. It is highly precise and focused radiation. If we miss, it will be a problem. Then we are not doing justice to the patients. So that's very important for us, that if we are doing, we should ensure that the patient will get the good success rate in the treatment, right? That is one thing. When you talk about the failure, there are very few failures. I mean, when you are saying telling the stories for the success, most of the stories are success. There are very few failures. Sometimes it happens the tumor is very close to the blood vessel. It has happened in some patient. The patient did not follow up for a long period of time after the first treatment, which is around 2-3 years back. Then they got a small recurrence in one area in the head. And we said, since it is a small recurrence, let us treat this patient with CyberKnife. But unfortunately, the tumor was growing, and then it involved the blood vessel and he bled. And with all the possible thing which we did, putting into the all kind of treatment for surgical, all these things which did not work in patients. So there are very few where I can say the failures, So because as a doctor, I must remember more failures than the success, because success is going to come in any case. When you are asking for success, majority of tumors have really done very well. There are few, and I will say less than, say, around 5 to 7% when we have treated with CyberKnife, we call it as a failure. Majority, as I told you, that sometimes it is so remarkable when the patients, when we treated with trigeminal neuralgia, we have treated so many patients. I can tell you all the examples. By the time they come out of the treatment from CyberKnife, they are so happy and they say, okay, give me something to eat, which they have not and been eating for years together. Right? And immediately they come up and they say, oh my God, there is no pain. I can really put my hands on the neck and I can put my hands here, because that was very difficult. So then these all kind of very success where we are so happy. We have treated many patients with a tumor, and their tumor, which we have seen around 3 years, 4 years later on, there's nothing else. They are really living normal life. So there are plenty of patients where we'll say they have done very well.
Amazing. I'm sure that life-changing experiences for patients with this invention of CyberKnife, with the precision that it can cure. I'll go to the questions from the audience, right? Mr. Wahid is asking, TB infection, which is causing lung cancer. If someone has TB and got some spot on the lungs, is it curable, or does she need radiotherapy for this?
Can you repeat the question that I listen?
Yeah, doctor, there is apparently a case where a TB, which is caused lung cancer, okay. And if someone has TB and got some spots on the lungs, is it curable, or does it need a radiotherapy, or is it a candidate for CyberKnife, or what kind of therapy that would you recommend?
See, tuberculosis is quite common in Asian countries. And when you're asking whether TB has caused cancer, it is not true. Cancer has got certain other things from which the cancer can come, and the TB is a bacterial disease, so they are two different things. So I will take it from that point of view. A patient also had a TB earlier, tuberculosis was treated. Now they have got a lung cancer, and that can be treated very well. If it is a small tumor, which can be very well seen on the CT MRI, preferably if it is a peripheral tumor, not moving too much with the lung movement, they are in a small tumor, they can be very well treated with CyberKnife, and you get almost curable result from the CyberKnife in these tumors. So absolutely not a problem. Small, the tumor has to be relatively small. Or second thing I can tell you, even if the tumor is bigger, say around 5 centimeters something, or maybe more than 5 centimeters, we can give chemotherapy in the very beginning so that tumor shrinks and it becomes very small. And then we can give a CyberKnife for these patients. So they can be treated very well in these cases. And today, lung cancer is something where there's a lot of medication, you have doctors in the panel. They must be knowing there are a lot of biological agent as well, the chemotherapy agent. It's really can be treated very well.
Yeah, that's right. And I think, in terms of number of cases that when we see across the board, it becomes easier for us to make a decision in terms of recommending to the patient on what stage they should really make a decision. In terms of success rate, what exactly do you think would be the success rate when they choose this model of treatment?
So when we are talking of success rate, one thing is benign tumors. When you're talking, when I showed you schwannomas, meningiomas, arteriovenous malformation, it's 100% success. As long as they are small tumors. Basically, our aim is to arrest the growth. So they not grow. We are not really bothered too much. They will metastasize, they will go somewhere else from the brain to other area. So that is almost 100%. The growth is arrested.
Yeah.
And that we have seen in the literature for almost 10 to 15 years. There is absolutely no problem in these patients. There are a few cases where the meningioma and schwannoma has recurred in the same area after 10 to 12 years. And where again the CyberKnife is given and they remain again the control. So benign tumors is absolutely not a problem. Now the problem comes with the malignant tumors. When I am talking of malignant tumors, something means brain, the gliomas or glioblastomas or the metastasis. Now I can give an example, the success rate of metastasis, which is the common one, right? Brain tumor. So patient has got a lung tumor or the breast tumor or somewhere else, and then there is a brain metastasis, maybe 1 or 2. We can give radiation with CyberKnife, but the problem comes in case suppose they get another metastasis in the other part of the brain that we are not treating. So people have treated up to 21 to 22 times. One, the brain metastasis come, you treat, after 2 years, there may be one more metastasis, you again treat with CyberKnife. So again, here the success story is there is 100% for that area. Then they get it.
Right.
Now, in cases of the glioblastoma or the other brain tumors, or maybe the other tumors, it depends on the size of the tumor. If it is a relatively small, it is definitely controlled by 100%. Or if the larger, then it may be around 70–80%, depending on the size of the tumor and the biology of tumor. Sometimes the tumors are very stubborn.
Right.
And we can give certain amount of dose. We cannot give a very high dose to certain area. If I am treating liver, I'll be treating liver to certain dose. I cannot treat beyond that because then the other liver part will also be damaged. So that the success story is there that way, that around 70–80% there should not be any problem.
Right. In fact, good you touched on the liver because one of the audience members were asking if it can be treated for liver. But instead of me asking all the questions, I would like to open the floor for the audience to ask the questions themselves. So I request all the audience members, whoever want to ask the question, please switch on your video so that I know that you would like to ask a question. Then we will help you unmute. So to begin with, I see the video switched on by Shweta. Shweta Dhanda, we'll help you to unmute and you may please ask your question to the doctor. Shweta.
Good afternoon, sir. Thank you for giving such an informative session. It was really mind-opening. And sir, my question is that what are the irreparable damages of CyberKnife surgery?
Means irreparable damage for the tumor or to the normal tissue?
Tumor good if it goes.
So tumor is going to go, but what are the irreparable side effects? I would ask particularly.
It all depends how much dose has been received by the neighboring structure. So
Okay.
you're asking, I'm giving worst scenario, so that it is always happens better than what I'm explaining to you. Suppose I showed you one slide where there is a schwannoma very close to the brain stem, right? Or
Yes.
mid-brain.
Yes.
There was an
brain
MRI
stem.
slide. Yeah.
Yes, one of the MRI slide. And suppose there is a little higher dose to the smaller part of the brainstem where one of the nerve is coming out. Suppose hypoglossal nerve is coming out, right? So which is responsible for the taste? So possibly there may be a problem in altered taste if there is a high dose to that area. But we always take care that brainstem should not get more than 20 grays, and those things are there. So 20% of those, we always try, there should not be anything which is, we call it as irreparable damage. All the normal cells, fortunately, God has given them a wonderful thing. We call it a homeostatic control, so that they repair themselves, which is happening in our body now and then. When we are walking on the street, if we get a scratch, the body repairs that scratch. If there is some damage from some kind of radiation to the skin, body is repairing that damage. So fortunately, if the doses are not very high, where the chromosomes are completely broken and is not possible, then those side effects come. And I told you what are some of the example, that if there is a nerve damage in the eye, which cannot be saved, right? So there is a permanent damage to the one side of the optic nerve, patient will be blind for one eye. So this is a rare situation, but we always explain to the patient what can happen to this area, where we not be able, if the tumor is completely engulfing, surrounding the optic nerve, there's no way you can save it. That's by any means, whether it is surgery or radiation or chemo. This is what happens. But there's hardly anything which you can call it as irreparable damage. If that is there, we rely on, you can call it as on the body, or you can rely on the God, whichever you say.
And sometimes probably
Thank you, sir.
be finding the balance of probably I might have to let go of one eye to save my life. It could be that kind of a situation.
Correct.
Absolutely right. And we always give importance to the life rather than damage. We always say it's a therapeutic ratio, whether it is chemotherapy, surgery,
Finding
or
the balance in the decision making.
Yeah.
Yeah.
Thank you, Shweta, for asking questions.
Thank you, sir. Thank you, sir.
Let's go to the next member. I'd like to request Mr. Anjan Kumar Saha. Please proceed with your question. You can unmute yourself. Yes.
Sir, good afternoon, and thank you very much for giving me a chance to make your questions. So my question is that for breast cancer, there are a lot of breast cancer in Bangladesh nowadays we are getting. So CyberKnife is a very excellent idea for that. And recent, you also know, the lumpectomy and without amputation of breast is nowadays talking about. So CyberKnife is the right thing, I think. So we can promote here also CyberKnife for breast surgery. So is it appropriate for patients CyberKnife surgery for metastasis?
Yeah, when you're talking of metastasis from the breast, there are 2-3 things in the breast. One is that today the breast treatment is highly evolved. In earlier period, either do mastectomy, so remove the complete breast, or when you're giving radiation, you give radiation to the entire breast, right? So these things were there. So I'm talking in these, your answer in our question into 2 parts. One is where it is focused to the breast, one. So nowadays, what we call is a hypofractionation, so you can give radiation in a shorter period of time by linear accelerator, because the breast, unfortunately, the tumor is there, we consider that it is not only the localized, but it can be in some other part of the breast. If there is a 2 centimeter or 3 centimeter lesion in the one part of the breast here, there are possibility there may be something else. So that focuses on the entire breast. So you remove the lump, which is a focus, and then give radiation to the entire breast, but then give what we call as a boost radiation the tumor where the tumor was there earlier. So we call it as a boost radiation. Now, this boost can be given by CyberKnife. It's not a problem, basically, so that we are not giving much higher dose to the remaining breast, so the breast contour as well as breast, what you call as the breast anatomy is maintained very well. So that is one thing, So you can give. Secondly, your question is there on the metastasis from the breast. The breast can give metastasis to any part of the body, and the common is in the brain or in the bone, somewhere in the spine, as I showed you the example, or maybe in the liver. Now, if these metastases are small, and I gave an example, if there's one metastasis in the liver, one metastatic site in the brain, can very well be treated with CyberKnife, and in a shorter period of time, maybe if it is very small, maybe one radiation is good enough. If it is little bigger, say around 3 or 4 centimeters, maybe 5 times radiation, and it is all over. And then I said very carefully that we have to wait and patient should be kept under close observation, because this can give rise to another metastasis. So by grace of God, suppose they don't develop anything, perfect. But if they develop something, we should diagnose them still in early stage and can again be treated.
Thank you, sir.
Thank you, doctor. I think that was a very comprehensive answer, and I'm sure Mr. Anjan Kumar has got good inputs out of it. Now let's move to Mr. Usman. Usman, would you like to ask your question? Please unmute yourself.
You are muted, Mr. Usman.
Usman. Okay, let's go to Khandekar until Usman. Oh, okay, Usman is unmuted. We'll wait for you for the next one, Mr. Khandekar. Usman, go ahead with your question.
Yeah, good afternoon, or good evening, everybody, or good morning, everybody. Yeah, I was told that the CyberKnife machine is not a common machine, that many centers in India don't even have the machine, that is few centers that have. So I want to confirm, and I was even also told that the machine is not even in Africa. CyberKnife machine is not in Africa. I don't know how true it is. So I want to confirm that. Then my question is there any side effect of CyberKnife? Hello?
No, there, I mean, you.
Is there any side effect of it? And the treatment of it, is it a permanent one? Is it a permanent one? I mean, the treatment by CyberKnife, is it a permanent one? So it's two questions I asked. One, I heard that the meat is not common in India. It's not everywhere. It's not common. There is a very few in India. The CyberKnife machine. And also, I was told that in Africa, there is no CyberKnife in Africa. So, I don't know Africa. I don't know how to treat this. And secondly, did they have the side effects, the treatment? Maybe after, is it a permanent one? I mean, the treatment of CyberKnife, is it a permanent one?
So, I mean, if I understood, you are asking about the side effect. There are some permanent side effect of treatment with CyberKnife, isn't it? So, as I mentioned earlier, we always try to avoid the normal structures, normal body parts where the radiation should not be high at all. So there will not be ideally no permanent damage or permanent side effect of treatment of CyberKnife, except when we know it very well, there is something which cannot be avoided. So where patient suppose patient is coming from Africa, as you mentioned, that some areas where the things can not be really saved, there we tell the patient these are the side effects, which you have to live with that. So that is the only thing, and then the patient has to accept that yes, I will be able to live with these side effects for my lifetime. But there are hardly anything I will say, but it all depends on the site where we are treating.
So we could go case basis and give them the accurate information based on the organ involved or what exactly is the case about.
Absolutely right. Absolutely.
Thank you, doctor. Let's now move to Mr. Khandekar. Please proceed with your question.
Good afternoon.
Good
Kusum,
afternoon.
if you still have some question, we'll take it offline and I'll get you more information about it. With the interest of time, we will move ahead to the next one.
Actually, I have two questions. The first is CyberKnife only for cancer?
No. I mentioned to you
As well, right?
we put it the word as tumor, right? And as a growth, you can call it as. And I showed you some of the example of the benign tumor, not the cancer, right? So this is possible to do it without the cancer, but it has to be in a site where it can give rise to problem to the patient. So it is inside the brain or in the liver, somewhere there. So non-cancerous tumor can also be treated, but we have to really evaluate whether the CyberKnife is the only treatment for this patient or there are some other options available. For example, something can be taken out by surgery easily without much problem. So that we discuss with the patient. So that is not only for the cancer, but for the benign condition or non-cancerous condition. Now, there was some example which I think Vidya, you asked about if the patient has tuberculosis, which has caused cancer. CyberKnife is not for tuberculosis because tuberculosis, we have got a nice treatment by chemotherapy. So we always evaluate and give that these are the options for treatment. Probably CyberKnife is the only treatment or one of the treatment. That is one thing.
And actually, what is the maximum size of tumor can be treated by CyberKnife?
Invariably, we say that with CyberKnife, anything which is 4 centimeter or less is an ideal cancer to be treated. Ideal tumor can be treated, but we have treated up to 5 centimeter also. Sometimes if the normal structures are really far away, we can treat up to 5 centimeter. So that is what we have treated. Anything less than 5 is good for treatment.
Okay.
I will give a certain example also. Something is say around 1 centimeter, but very close to the within the say brain tissue itself, which can also be damaged. So that's what I was saying, that we have to see the scans, we have to examine the patient, and we have to discuss with the patients and relative. Suppose patient is say around 12-year-old girl or 12-year-old boy and has got a tumor. So we have to not only discuss with the patient, but also the parent. Right?
Yeah, family involvement would be required. Yeah, especially if there is a minor candidates. Yeah, completely.
Yeah.
Yeah.
Thank you.
Thank you, doctor. Now we will proceed to Judith. Yes, Judith, if you could unmute yourself. Dr. Sasson, would you like to ask question? Just raise your hands if you would like to, then I would unmute myself next. But let's go to Judith first. Yeah, wait, hang on, and we do your next question. We'll go to Judith.
Hello, you can hear me?
Yes, Judith, please go ahead.
Yeah, good afternoon. Thank you, doctor, for all the information. I have 2 questions. Of cobalt and linear, which is a better option that has less side effects, very effective? And then secondly, you talked of you talked of when you use the CyberKnife, some surgeries are not needed. Could this be the case also for breast cancer? Is there an option of using a CyberKnife without surgery? I'd be glad to know. Thank you.
Very nice. I think nice question. One is you are asking about the difference between cobalt and linear accelerator.
Yes.
I will not say that cobalt is bad, but I will linear accelerators are better. The reason is quite simple, because linear, unfortunately or fortunately, there have been more of the research as well as the technical advances which has happened in the linear accelerator rather than cobalt. And the reason was quite simple. Linear accelerator, the moment you shut off or you just switch off the linear accelerator, there's no radiation. While cobalt machine, there's continuous radiation and a radioactive substance, and it can be abused in certain situations. Nowadays, the things are very different because of terrorism and other things. So people prefer the linear accelerator. And as I mentioned, that there have been a lot of research, a lot of technical advances which has happened in linear accelerator. So therefore, linear accelerator appears to be better. Especially when you can really change the energy of the linear accelerator, energy of the photons or the X-rays, then it becomes a very, very different and useful machine as such. So the linear accelerator are better as compared to the cobalt. I give an example of the cobalt machine with the gamma knife, right? Where the gamma knife was made by the cobalt sources, right? And the CyberKnife is with a linear accelerator. So that is the difference, but both, especially for the brain tumor, will give you the similar kind of control rate. But being a much more versatile machine by CyberKnife, it appears to be better from the technical point of view. By use point of view, the CyberKnife is better, or I'll say linear accelerator. Your second question is about the breast cancer, where the conservative management can be done by the cyber itself at all. So that is what I explained in the very beginning about the breast cancer. The breast is considered as a multicentric disease. It can be other part of the breast tissues also. We may be noticing one. So CyberKnife per prime as a sole treatment of breast cancer is not right. There are a few people who have been trying to use the CyberKnife rather than doing a surgery for a smaller tumor, right? So the generally accepted or standard treatment for breast cancer is that if it is a 1 centimeter or 2 centimeter tumor, you do surgery. So remove only the lump, not the other part of the breast. So breast contour is well maintained. So cosmesis is well maintained. And then you give chemotherapy and radiation as it is required on the histopathology. Now, many people have thought that why to do surgery, why not to do radiation alone rather than removing the lump. You give radiation and chemotherapy and also give CyberKnife or highly localized radiation therapy to the lump area. But there has to be a really randomized study which has not really come up. So we will not be able to tell you right now that there's no surgical option, but possibly in coming future, which I really envisage, maybe another 5-10 years, there will be something not to touch the breast. Without touching the breast, you treat.
So it will be conserved. Breast conservation will happen.
Yeah. But today also we call it a conservative management. Today also we are calling, but there is small nick around the areola, around this. So the patient still feel that there's nothing has been done as yet.
I think that would be an ideal situation. Let's hope our science advances to that level.
Absolutely.
Yeah. Thank you, Doctor. We'll take last 2 questions. Thank you for being patiently giving us elaborate answers. It's very valuable for us. I think all the members are really, will go home with good information. I would now like to move to Dr. Sasan Momeni. Please go ahead with your question, Dr. Sasan.
Yeah. Thank you very much. I just want to appreciate you for organization this nice webinar, and I want to appreciate Professor Dr. Shyam, very, very valuable. It's very interesting. I have some business question. I prefer to send the email to you. Thank you very much. I stay to this was very useful. Thank you, doctor.
Thank you.
There is questions about patient. We will take it offline, costing and all that, but we will take it offline. Once we get the reports and stuff like that, we'll discuss with you. Of course, our office will coordinate for that. I'll be in touch with you, Dr. Sasan. Right. Yeah. And let's move to Mr. Nazir. Please go ahead with your question.
Good afternoon, sir. Sir, I have a question. When can CyberKnife be used, sir?
Sorry,
When can CyberKnife be used?
today, tomorrow, day after tomorrow,
No,
anytime?
at what stage of cancer,
Oh,
probably?
you are asking for stage. I thought
What stage?
CyberKnife can be used.
What stage of
stage?
cancer? Yeah.
It
Or
can
what
be-
could be the size of the tumor?
It can be treated, I mean, CyberKnife can be treated at any stage when you are talking of this. You know, we mentioned about that size of the tumor is more important for CyberKnife. As you asked me stage, so I'm just giving an example that if there is a breast cancer with a brain metastasis, we call it stage 4. Right? But stage 4 can be treated very well with CyberKnife to the brain area. Right? If there is a tumor in the, say, lung or liver, which is a, say, 2 centimeter periphery place, we call it stage 1. Right? We can treat with CyberKnife with a radical treatment. So those things are there. So I will not say that the stage is more important. The one is that the patient condition, the primary tumor, and wherever it has gone is more important for us. So therefore, in the very beginning, we said we must get all the reports and also examine the patient. Sometimes patient in a stage 3 or a stage 4 can really be helped by CyberKnife. Sometimes maybe even later stage or sometime early stage where it is not really very good. Rather than CyberKnife, something else can be there. For example, I have to say the lymphoma of the patient. And a patient comes with a Hodgkin's lymphoma, stage 1. CyberKnife is not the right answer, where the chemotherapy and the wide field radiation is better answer than the CyberKnife. So rather than really a stage, it is the disease and what is the extent of the disease that helps us in deciding this is the case for CyberKnife. But from your point of view, it is always good that you raise a question, can this be done?
Yeah. We
Isn't
could
it?
check with you just
Absolutely.
to rule out or
Yeah.
just to make a selection whether it's a right candidate or not.
Absolutely right. So if you feel that, yeah, this patient may be really helped, can be cured or something in your view, ask us and we will say, oh, yes, please send or please do, we will try to do something. Or we may say, no, it is not the right case, you do something else.
Perfect. I think that would be the right process.
I have another question, sir. What energy used for CyberKnife, sir?
6 MV photons.
Okay.
Thank you, sir. Thank you.
Yeah, thank you. I think if I can request for one more question, if you don't mind, Doctor,
Sure.
very quick one. I've been a little greedy now because we are just getting really information that we were longing for. Because we are sandwiched in terms of being between the doctors and the patients, and more information is always better for us. So I think I'll go to Sakira. Sakira, please go ahead and ask your question.
Vidya, you said sandwich, it should be a tasty sandwich.
Yeah, hopefully. Hopefully. Sakira, would you like to unmute yourself?
Hello everyone, I am Shakira Janak from Bangladesh. I have a question. Is CyberKnife treatment is safe?
Yes, very safe. Very, very safe. And we always see there's no side effect possibly. We always say there should not be any problem in this. It's very safe treatment.
Because of the precision and the finesse that is involved.
Absolutely. Absolutely.
Perfect. Perfect.
In conjunction with this, sorry.
Yes,
Sorry, in conjunction with this, somebody asked, does CyberKnife causes hair loss?
Yes, important question. Yeah, does it cause hair loss?
There are two things in there. When you say hair loss means patient become bald, or hair loss means little more hair loss. Say, we always say there's no hair loss after the CyberKnife treatment. The reason is that we give from the multiple angles with small doses to surround this area. But as usually you say, when you are combing your hairs, there will be 5 or 2 or 3 hairs that will come. But after CyberKnife, it may be slightly increased. Rather than 2, it may be 5. But that is for a shorter period. So the patient will not become bald. Only there may be a little more hair fall that you can see. Otherwise, nothing. And that is true when we are
if it is
radiating
not
all.
a CNS case, if it's not for the brain tumor,
Yes,
if
yeah.
it's any other part of the body, would they still have
No,
hair
no,
loss?
no, no.
Not at all,
Only
right?
when we are
Because-
treating the head. Only we are treating.
Yeah, exactly. Only if it is on the head.
True. If you are treating pelvis, you are treating lung, or so, there is no hair loss.
Absolutely. Yeah, absolutely. Perfect. Jahir Bhai, do you have a question or can we go to the next segment?
I suggest we go to the next segment. It's already
Yeah,
3:30.
okay. I think everybody has been patiently waiting. We've crossed 90 minutes of our time. Thank you, everybody, for such valuable time. And I think Professor Shrivastava has been very kind with us for giving us wealth of information. But still, Doctor, we have a list of other questions that has come through. But if you don't mind, we'll share with you on email. We'll collect the answers from you, and we would like to share with all the members who have asked this question. We'll take it forward after the session is over. And for this segment to have been able to happen, and also for the academy to be established and to impart the knowledge to all the stakeholders, one man who had this vision to make all the stakeholders in the industry to be empowered is my dear friend and brother, Mr. Mihir Vora, who is a founder and CEO of Simplify MVT as well as Magnus Medi. So I'd like to welcome Mihir to please express your vote of thanks. Over to you, Mihir.
Thank you, Vidyaji, such a kind word. So, ladies and gentlemen, on behalf of Simplify MVT Academy, I would like to extend our heartfelt gratitude to each and every one of you for joining us today for this enlightening knowledge session on CyberKnife. We hope that the insights shared by our esteemed speaker, Professor Dr. Shyam Shrivastava, have been invaluable to you. We are immensely grateful to Dr. Shyam for sharing his expertise and shedding light on the significance of CyberKnife in the field of medical tourism. You know, with this, he has made us very easy to understand for CyberKnife, and specifically for non-medical stakeholders like us. His vast knowledge and experience have provided us with a deeper understanding of this cutting-edge technology and its transformative impact on cancer treatment. I'm very sure that Dr. Shyam is very approachable. So in case you have any questions, we can definitely reach out to him. We also want to express our gratitude to all the participants who have been taken the time out of their busy schedules to be part of this session. Your dedication and commitment to assisting foreign patients, particularly those who are worried and scared, are truly commendable. We understand the crucial role that we all play in guiding patients through their treatment journey and providing them with necessary support and reassurance. I am sure that this would have helped us to get more better information to give better care. Not to forget, I would like to thank to entire team of Simplify MVT and Academy to make this a success. This is the inaugural session, and we are sure that we will come up with more sessions. Special thanks to Vidyaji. She is a business head for this academy, and Sachi. Their hard work and dedication in creating this academy and curating the informative sessions have contributed to empowerment, and I'm sure it will continue to do so. As we conclude the session, we encourage you all to apply the knowledge gained today in your respective roles and continue to provide exceptional support and guidance to scared patients seeking treatment in India or anywhere in the world. Remember that your efforts make a significant difference in their lives and contribute to the growth and success of medical tourism. Once again, thank you to everybody. Over to you, Vidyaji.
Thank you, Mehir.
Yogesh and Jitendra there. I think they were there earlier.
I am not sure, sir. Let me check. Yogesh would be there. Yogesh bhai, can you please start the video?
Yogesh and Jitendra, because they phoned me. Yeah.
Jitendra is also there. Yes. I forgot to thank the esteemed team of
Hi.
Yes,
Hi, everyone. Sorry, out and not in office today.
Okay.
So, sorry for the casual attire.
No worries, no worries. Thank you for coordinating and helping us to get to Professor Shrivastava. Thank you for that.
All right, Vidya ji, you can begin.
Yeah.
No,
Thank you.
have to also have to actually. Yeah. Thanks a lot, Mihir, for organizing
Yeah.
such a beautiful event. I guess it was great. We are grateful for you to organize an event with such good audience, and hope everybody liked the session. And we are hoping.
Thank you, Yogesh. Thank you. I think the very fact that the session has been successful is that the questions are still streaming through. Questions are still constantly coming. That means the audience members were so engrossed and so interested in this. I'd like to inform to all the members of the audience that a team member from our group will contact you, and please provide your genuine feedback. Let us know your real evaluation so that will help us to improve the next sessions, and also probably give us what kind of topics in future that you would like to learn more about, so we can bring in experts from those fields and bring you excellent knowledge sessions. And also everybody in the audience will get a certificate which will help us to further in our career. And with this, I strongly believe that knowledge is the only and the best method for us to proceed further, to be stronger in our work that we do. So let's embark on this knowledge journey and stay safe, stay healthy, and let's spread health to everybody who is around us. Thank you, everyone, and goodbye for now from Simplify MVT Academy. Thank you.
Thank you. Thank you.
Bye.